Hello, and welcome to the SCA Fiscal Training. This training was created and is being delivered by the Program Monitoring Section of DDAP's Bureau of County Program Oversight. The purpose of this training is to provide an overview of how SCAs are funded and DDAP's requirements for SCAs to implement and report on this funding. The target audience for this training includes SCA fiscal and administrative staff. We hope you'll use this training for staff who are new in these roles and that you'll also find it to be a helpful refresher training whenever needed. While each section of this training will be presented by a different staff member, any follow-up questions after completing this training should be directed to your SCA's project officer. This slide includes a list of project officers and their contact information.
Hello, my name is Kelly Nardone, and I'm one of the 4 project officers in the Program Monitoring section within DDAP. In this module, we'll be focusing on Funding Sources Part 1, DDAP State Funds, Federal Substance Use Block Grant, and Pregnant Women, Women with Children. First, I want to review the objectives for this presentation. My goal for today is for you to increase your knowledge of the funding sources, who receives funds, when the funds need to be spent, and the population for whom funds should be expended. Increase your understanding of the importance of pregnant women and women with children funds while receiving resources to help support you in meeting the maintenance of effort. Obtain resources to empower you to have the information needed to be successful in your role. I'm going to start with an overview of the various funding sources that you'll encounter as SCA fiscal officers and administrators. The majority of funds run on a state fiscal year. The dates for the fiscal year are July 1 through June 30th, and these are the funding streams based on the state fiscal year. State, base, or general assistance, federal, substance use prevention, treatment, and recovery services block grant, the SUBG, state, assessment and residential treatment, that would be your Act 2010-01, and state compulsive and problem gambling treatment. First, let's talk about state funds. State funds are issued by DDAP for administrative functions and the provisions of prevention, intervention, treatment, and treatment-related services. Base dollars, also referred to as general assistance state dollars allocated by DDAP that are not reserved for any particular priority population, service, or any limited term project. Base funds can be budgeted among the various activities at the discretion of the SCA. State funds can be moved between activities. Please note that you have a little more leeway with state funds than any other funding stream. State funds are the only funding stream that can be moved between activity. That means all categories, activities are interchangeable. All SCAs receive state general assistance funds. Any of these funds budgeted for administration, Activity 5100, cannot exceed 20% of all DDAP expenditures. And to clarify, that's 20% of what the SCA spends in DDAP funds, not 20% of your allocations. This is automatically calculated in SDS when completing year-end reporting. State funds not spent during the state fiscal year cannot be carried forward without DDAP's permission. Other state funds include Act 2010-01. Act 2010-01 Assessment and Residential Treatment Funds are solely for drug and alcohol addiction assessments, including substance use disorder assessments associated or related to compulsive and problem gambling, and for the related SUD treatment in non-hospital residential withdrawal management facilities, non-hospital residential rehabilitation facilities, and halfway houses licensed to provide SUD treatment services. All SCAs receive these funds for non-hospital residential treatment and level of care assessment services. I also want to add that DDAP is required to provide the Governor and General Assembly a report no later than the first day of October annually, reflecting data and progress resulting from the funds expended as a result of this act. And I'm going to end the overview of state funds with compulsive and problem gambling treatment funds. CPGT It's for programs for the prevention and treatment of gambling addiction and other emotional and behavioral challenges associated with or related to gambling, and for the administration of the compulsive and problem gambling program. These funds were awarded to SEAs for administration and prevention. SEAs must spend these funds according to the spending plan approved by DDAP. Substance Use Block Grant, often referred to as the federal block grant, are federal funds that also run on the state fiscal year. These allocations are primarily based on population. They're used for prevention, intervention, treatment, and treatment-related services. You cannot use these funds for administration in Activity Codes 5100 or 5300. This is formerly known as the Substance Abuse Block Grant, or SABG. Please note that 5200 is not currently in use, and 5400 requires special permission from DDAP. And just to be a little more confusing, I wanted to mention that this block grant can also go by Substance Use Prevention, Treatment, and Recovery Services, SUPTRS block grant, but I will continue to refer to this funding stream as the federal block grant or the Substance Use Block Grant for the remainder of my presentation. So with regards to the Substance Use Block Grant funds, the SEA must budget and spend the SUBG prevention allocation, as outlined in the award letter, on primary prevention programs. You still must spend a 20% set aside for prevention, and SUBG funds drawn down but not spent in the state's fiscal year may not be carried forward. Substance use block grant prevention dollars should be spent based on what's in your SEA prevention plans. SUBG intervention, treatment allocation are combined with drug and alcohol into one allocation. However, prevention and intervention treatment categories are separate allocations. There are specific restrictions in the federal block grant or items that you cannot spend federal block grant funds. These are called prohibitions. The substance use block grant prohibitions are inpatient hospital services, such as hospital-based rehab, provide cash payments to intended recipients of health services, purchase or improve land or buildings, satisfy any requirement for the expenditure of non-federal funds as a condition for receipt of federal funds, provide financial assistance to any entity other than a public or nonprofit private agency, provide individuals with hypodermic needles or syringes, and provide workforce recruitment and retention measures involving staff loan repayments or tuition reimbursement. If you want more details on these prohibitions, please go to section 7.04H in the operations manual. Another prohibition would be the SEAs cannot use federal funds directly or indirectly to purchase, prescribe, or provide marijuana or treatment using marijuana. Treatment in the context includes the treatment of opioid use disorder. See Section 45 CFR Section 75.300A, requiring HHS to ensure that federal funding is expended in full accordance with U.S. statutory requirements. 21 U.S.C. Section 812 C10 841, prohibiting the possession, manufacture, sale, purchase, or distribution. Now we're moving along to discuss pregnant women and women with children funds. Pregnant women and women with children funds are allocated to most SEAs as part of the SUBG. Women must either be pregnant, have custody of their children, or be seeking to regain custody of their children to use the funds for treatment. SEAs may use other DDAP funds as well as non-DDAP funds for this population as applicable. However, SEAs should prioritize spending the block grant funds on pregnant women and women with children before spending other funds. I just want to mention that in the current 2025 grant agreement, no prevention funds were awarded for pregnant women and women with children. However, regular prevention funds can be used to support pregnant women and women with children prevention programs. The SUBG requires Pennsylvania to spend a threshold amount on pregnant women and women with children each year, which is called maintenance of effort. To ensure Pennsylvania meets the threshold requirement, DDAP sets aside a specific amount of SUBG funds that each SEA must spend on pregnant women and women with children. The set-aside SUBG pregnant women and women with children funds are awarded under the intervention, treatment-related category. One very important item to note is that SEAs must spend their set-aside for pregnant women and women with children as allocated before other DDAP funding sources can be utilized for this population. Why does DDAP require SCAs to report expenditures for this population? The SCA must keep track of the funds used for pregnant women and women with children to determine the ability to meet the set-aside amount or whether a set-aside exception request is needed. So it's important to track pregnant women and women with children funds separately from all other funds to ensure your SCA is meeting the set-aside obligation. Please know DDAP is always willing to entertain new and innovative ideas for spending pregnant women and women with children funds. So pregnant women and women with children must be reported on each quarter, and it should be cumulative. Project officers will reach out with questions when expenditures fall below specific thresholds during the reporting period. Individuals receiving services who are a pregnant woman and/or a woman with a child or children should be reported under the PWWWC. SEAs should have mechanisms in place to track this population for reporting purposes. PWWWC funds can be used for any outpatient and inpatient levels of treatment and/or treatment-related services to include case management and ancillary services such as shelter, healthcare, daycare, etc. They're not permitted to be used for hospital services as medically managed levels of care. That would be your 834 A's and B's. SUBG prohibitions apply to this population. An exception request is when the SCA is unable to fully expend all pregnant women and women with children funds, and with prior written approval, the SCA may utilize these funds for other drug and alcohol activities for the general population. All exception requests must be submitted with adequate justification by April 30th each year. The exception requests are due the same time every year. Therefore, you should mark this date on your calendar now. DDAP project officers will supply the justification document when requested by SCAs. When submitting your pregnant women with children set-aside exception request to DDAP, SCAs will be expected to address the following. What attempts has the SCA made to spend the funds? Has the SCA expanded case management to provide this service to pregnant women, women with children, even if the SCA isn't funding the treatment? Is the SCA offering ancillary services per the requirement in the federal block grant? After completing the quarter 2 report and reviewing your expenditures in early April, if you believe you will not be able to spend the minimum amount allocated, reach out to your project officer. There may be additional conversations with the SCA discussing programming for pregnant women in order to meet the maintenance of efforts for the federal block grant. To help support you in identifying expenditures for this population, you may be asked to create a comprehensive plan, such as the following. A member of DDAP's treatment division will reach out if this plan is something that is needed from your SCA. Although this concludes this portion of the module, I did want to provide you with additional resources. All DDAP manuals and other resources can be found online at the link listed below. Additional information regarding funding can be found in your fiscal manual in sections Funds Use and Allowability, section 4.04. Additional information regarding prohibitions can be found in your operations manual in both sections 7.04H and T. Updated Substance Use Block Grant, or the SUBG prohibitions and restrictions, can be found in that website as well under the Grant Agreements, Incorporated Documents, sections G. If you're unable to locate information in the resources listed above, you may contact your assigned project officer for additional consultation. Thank you so much for your time today. Next, I'll pass it to Bobby to review some additional funding sources with you.
Hello everyone, this is Bobby DeLallo. I am one of the project officers with DDAP's Program Monitoring Division. In this module, we will be focusing on Funding Sources Part 2, DDAP specialty funds and non-DDAP funds, and how those funds can be spent. In this section of the training, we will cover the following funding streams: State Opioid Response, or SOAR funds, COVID Supplemental Block Grant funds, American Rescue Plan, or ARPA funds, and non-DDAP funds. We hope this information will increase your knowledge of these funding sources and what activities the funds can be spent on. The first funding source I will review is State Opioid Response Funds, also known as SOAR funds. These funds are broken into the following categories: prevention for activities 6100 through 6600, and treatment funds for intervention, treatment, and treatment-related services. Both prevention and treatment SOAR funds may also be used for activities 5100, administration, 5300, evaluation and research, and 5400, special projects, as directed by DDAP. The SCA must track their SOAR funds by how they are broken out on their schedule of funding. SOAR funds run on a federal fiscal year, which is why unused funds may be carried into the first 3 months of the next fiscal year, which is July 1st to September 29th. To carry funds forward, SCAs must invoice DDAP in a timely manner. We talked more specifically about SOAR timelines. However, some SOAR grants will have a no-cost extension. A no-cost extension is if funds cannot be spent by the end of the SOAR grant, DDAP can request a no-cost extension for up to 1 year to give SCAs additional time to spend down these funds. DDAP will notify SCAs of a no-cost extension prior to the end of the current SOAR grant. Your SCA must deplete any no-cost extension funds prior to drawing the next funding year for SOAR. Now we are going to talk about COVID Substance Abuse Block Grant Supplemental Grant Funds. DDAP allocated COVID Supplemental Block Grant Funds to the SCA in 2 areas: prevention and intervention, treatment, and treatment-related. Funds allocated for the intervention, treatment, and treatment-related categories shall be used for the COVID Case Management Services Initiative and the COVID Recovery Support Services Initiative. It is important to note that some SCAs have a specific amount designated for COVID case management and a specific amount designated for COVID recovery support services in their schedule of funding. The timelines for COVID Substance Abuse Block Grant are July 1st, 2021 through June 30th, 2022. Carryover was permitted to be used from July 1st, 2022 through March 14th, 2023. 2 no-cost extensions were granted, and funds may now be used through December 31st, 2024. These funds should be invoiced based on actual expenditures. Now we are going to talk about American Rescue Plan, or ARPA funds. These funds were allocated for prevention activities from March 1st, 2023 through June 30th, 2023. Carryover is permitted to be used from July 1st, 2023 to June 25th, 2025. Invoicing should be based on actual expenditures and should be based on the SCA's prevention plan for these funds. Now we are going to do a quick review of non-DDAP funds. Examples of non-DDAP funds are BHSI, Act 152, Health Choices, HSBG, HSDF, CYS, DUI, PCCD, interest income, county, opioid settlement, and other D&A income. Starting with BHSI funds, with BHSI being an acronym for Behavioral Health Special Initiative. These funds are provided by the Department of Human Services, or DHS, and used for individuals who are uninsured, do not have insurance that covers the service they need, or cannot obtain medical assistance benefits. Funds can be used for the full D&A treatment continuum of care. These funds may also be used for administration, case management services, housing, and recovery support services. Funds are generally not permitted for prevention or intervention services. BHSI funds projected to be unspent are sent to the hub, which is Lycoming and Clinton SCA, and redistributed to other SCAs as needed. Next is Act 152 funds. These are state funds issued by DHS to provide non-hospital residential withdrawal management and rehabilitation services for individuals eligible for medical assistance under fee-for-service and who are not yet enrolled for services under the Medicaid Health Choices waiver. SCAs are expected to verify that people receiving services are Medicaid eligible. Act 152 funds projected to be unspent are sent to the hub, which is Lycoming and Clinton SCA, and redistributed to other SCAs as needed. Health Choices is income received by the SCA from the local managed care organization, or MCO, for the provision of administration and clinical care services related to the Health Choices program. For example, case management, administrative and/or clinical oversight of the programs related to the MCO. Human Services Development Fund, or HSDF, are state funds issued by DHS to provide various human service initiatives. The allocation of these funds to the SCA is at the discretion of the county. Your Human Services Block Grant are several appropriations within DHS and consolidated for distribution to counties as a block grant to provide local flexibility in the delivering human services programs. Funding may cover most substance use intervention, all treatment, and certain treatment-related activities, including case management and case coordination. Children, Youth, and Family Funds. These are funds received from the local Children and Youth Office and utilized by the SCA for the provision of substance use, misuse services to clients involved in the children and youth system. DUI funds, or Driving Under the Influence funds, are issued to the SCA by the county for aiding programs promoting alcohol misuse prevention, education, treatment, and research. Distribution of these funds is at the discretion of county executives. PCCD, or Pennsylvania Commission on Crime and Delinquency funds, are issued to the SCA for the provision of substance abuse services related to intermediate punishment programs or juvenile incentive initiatives. Interest income is monies received through interest-bearing accounts for funds managed at the SCA level. Interest must be spent prior to the expenditure of DDAP funds. County funds are funds provided by the county which meet or exceed the county's required financial commitment to the SCA for the delivery of D&A services. County match is required for the following activities: administration, prevention, intervention, and treatment activities 861A, outpatient, and 861B, intensive outpatient. The minimum required match amount is determined by dividing the total budgeted state funds in the above activities by 9. The actual required amount of the match is based on year-end expenditures. Your county match is also calculated in the fiscal summary report in SDS. You will need to check this during quarter 4 reporting prior to submitting your report to DDAP. Opioid settlement funds are funds received by the Commonwealth through the National Opioid Settlement. Counties have received these funds and they will be distributed to the SCA based on the discretion of county leadership. If your SCA receives these funds, there is a column under non-DDAP funding in SDS to enter those expenditures. We encourage you to continue to have conversations with county leadership on the use of these funds. And finally, this leads me to the other D&A income, which is all other income received by the SCA for the delivery of D&A or gambling services, but not defined in the previous slides. This concludes my portion of the presentation. Now Mary is going to talk to you about activity codes.
In this section, we're going to review DDAP activity codes, section 1.03 of the Fiscal Manual. And by the end of this section, you should have an increased knowledge of fiscal management of substance abuse services and be able to identify key activities within each level of substance abuse service, ensuring accurate reporting of expenditures. You're encouraged to go to section 1.03 of the Fiscal Manual and follow along with the content that's being shared. Consider printing the activity code page at the end of the section for an easy reference. These codes are important because this is how the SCAs must report expenditures by activities and services. This information is reviewed, combined, and shared with the federal organization, Substance Abuse and Mental Health Services Administration, also known as SAMHSA, who then determines Commonwealth funding levels in future years. You, as fiscal officers and administrators, are our first line in ensuring that we accurately report expenditures so that the citizens of Pennsylvania can have and maintain access to prevention programming, interventions, drug and alcohol treatment, along with gambling addiction treatment, so we can continue to promote recovery and reduce the human and economic impact of the disease of addiction. All the information reviewed in this section can be found in the DDAP Fiscal Manual under Activity Definitions, section 1.03. This image is the last page of section 1.03 and gives us a snapshot of the codes we will use and review today. The single county authority is responsible for planning, allocating funding, and overseeing substance abuse services. These activity codes focus on administrative tasks and oversight rather than direct client services. Activity 5100 involves planning, organizing, and managing substance abuse programs. Staff costs are considered administrative if they are not directly involved in service provisions. It's important to note that an agency cannot exceed 20% of DDAP funds on administrative expenses. Activity 5200 is reserved and not currently in use. Activity 5300 is reserved for research and evaluation projects that have been approved by DDAP. Non-DDAP funds can be used for research without DDAP's approval. Activity 5400 is designated for special projects approved by DDAP. Examples include specific administrative tasks and again require DDAP's permission. Prevention efforts focus on stopping substance abuse and problem gambling before they occur. Programs and activities aim to educate, inform, and create supportive environments. Activity 6100 spreads awareness of substance abuse and problem gambling risks through one-way communication. Activity 6200 focuses on two-way communication to teach decision-making skills and media analysis for better choices. Activity 6300 encourages healthy activities as substitutes for substance abuse and gambling. Activity 6400 identifies individuals with emerging substance abuse or gambling issues and provides support or referrals to those individuals. Activity 6500 builds on community capacity to prevent substance abuse and gambling through events and collaboration. Activity 6600 modifies community rules and attitudes and environments to deter substance abuse and gambling. Activity 6700 is for DDAP-approved initiatives that don't fit other prevention categories and requires DDAP's permission. This level is about providing services to help people recognize and reduce their risky substance use behaviors. It also includes support for families affected by substance use disorders. Activity 7100 is reserved and not currently in use. Activity 7200 aims to help individuals recognize and address substance use issues and address related health concerns like HIV and hepatitis. This activity includes things like screening and education. This can involve group or individual discussions, offering referrals, advice, and crisis help over the phone, finding people who misuse substances and encouraging them to seek help, promoting available treatment, case management, and recovery support services, offering support groups for family and friends of those with substance use disorders, offering groups to support people who have lost loved ones to alcohol or drug-related causes, offering HIV prevention, counseling, testing, and linking with health services, educating the public about hepatitis, offering screening and testing, and reducing stigma around the disease, as well as providing and distributing naloxone, a medication to reverse opioid overdoses, and training people on how to use it effectively. The treatment level focuses on addressing substance use and gambling problems through diverse services. 861A, or outpatient ASAM Level 1, is non-residential treatment with scheduled sessions, typically less than 9 hours per week for adults and 6 hours per week for adolescents. 861B, or intensive outpatient ASAM Level 2.1, is more intensive outpatient treatment structured for 9 to 19 hours per week per adults and adolescents. 852A, or partial hospitalization, ASAM Level 2.5, is intensive treatment for 20 or more hours per week, providing skilled services. 852B, or clinically managed low-intensity residential services, ASAM Level 3.1, consists of residential programs with 24-hour support and less than 5 hours per week of treatment. 823A, or medically monitored inpatient withdrawal management, ASAM Level 3.7 WM, is inpatient care with 24-hour medical evaluation and withdrawal management. 823B, or clinically managed medium/high intensity residential services, ASAM Level 3.5, are residential programs offering stable recovery environments with 24-hour support. 823C, or medically monitored intensive inpatient services, ASAM Level 3.7, offers structured inpatient treatment with 24-hour professional care for severe issues. 834A, or medically managed intensive inpatient withdrawal management, ASAM Level 4 WM, offers inpatient care with 24-hour medical management in an acute setting. 834B, or medically managed intensive inpatient services, ASAM Level 4, is acute care inpatient treatment for severe biomedical, emotional, and cognitive issues. 8900, or physician and pharmacy, is for medication-assisted treatment for substance use disorders administered separately from treatment providers across various levels of care. Treatment-related services provide support for treatment activities indirectly by addressing other life challenges and promoting recovery and independence. Activity 9100 identifies clients' needs and coordinates services, including screening, assessment, and ongoing planning. 920E offers temporary shelter for homeless individuals in drug and alcohol treatment or recovery support services, limited to 30 days per individual per year. 920R provides safe and supportive housing for individuals in addiction recovery, requiring DDAP licensure for referrals. 920D allows for exceptions for temporary housing services with prior approval from DDAP. 930R is non-clinical services aiding substance use recovery, such as mentoring, education programs, or telephone support. 930D offers additional recovery client-related services, subject to DDAP approval when using DDAP funds. For additional information, please see Section 1.03 of the Fiscal Manual.
Hello, fiscal officers and SCA administrators. This is Cindy Klopak with Program Monitoring. I'm one of the project officers who works with the SCAs. This training will cover funding awards, schedules of funding, and amendments to the grant agreement with DDAP. Now that you have a good understanding of DDAP funding streams and activity codes, this training will cover how you are awarded these funds and how to use the information you receive from DDAP. At the end of this training, you should be able to read and understand a schedule of funding, understand amendments to the grant agreement with DDAP, understand the revised schedule of funding, and then be able to use the information to apply to your own SCA. First, some background information. DDAP enters into 5-year grant agreements with county executives or governing boards as appropriate for all 47 SCAs. And the grant agreement contains information about base funding that will be awarded to the SCAs throughout each of the 5 state fiscal years in the grant agreement. This training is not intended to review the elements of the grant agreement. However, for your knowledge base, it is good to have a copy of it and review it. Each year of the grant agreement starts with base funding, and typically, the base funding is the same for each year of the grant agreement. Funds you can expect to have July 1st are state general assistance, state gaming, compulsive problem and gambling treatment, and federal block grant, prevention and treatment. The grant agreement includes Appendix C, which is also known as the schedules of funding for each of the 5 years. The schedule of funding is the document you will use to know how much funding has been awarded to your SCA by funding stream. This is a 2-page document. For the purpose of this training, Appendix C will not be covered since a lot of the information has been revised since the current grant agreement has taken effect in July of 2020. You can still review this information and ask questions if you need clarification. For the purposes of this training, the information presented is based on fiscal year 23-24, but the general information can be applied to future state fiscal years. One thing to keep in mind during this training is that your schedules of funding will look different, and it will be helpful to review your SCA's information after completing this training. The schedule of funding you see here is a sample of what was awarded to an SCA in fiscal year 23-24, and this includes the base funding highlighted in yellow. These funds were awarded in the grant agreement for fiscal year 23-24 and may be used for services July 1st, 2023 through June 30th, 2024. We will cover the section that is grayed out in just a bit. On this schedule, you will notice that the compulsive and problem gambling treatment amount on this schedule is blank, which is likely different than what was initially awarded in the grant agreement. Gambling revenues had significantly decreased during the COVID pandemic. Therefore, there have been changes to how gambling funds are awarded each year. SCAs have been working closely with DDAP's gambling unit to determine appropriate amounts to award, and this amount is determined at a later date for each SCA. This is what is known as a funding reduction change order. When this occurs, correspondence goes out to the SCA. Page 2 of the schedule of funding includes the breakdown of federal block grant funds and is consistent with the information in the grant agreement. In addition, this page also includes the minimum amount the SEA is required to spend on the pregnant women and women with children population as a maintenance of effort every state fiscal year of the grant agreement. The amount listed here is the portion of federal block grant intervention and treatment funds that must be spent on this priority population. Pregnant women and women with children funds are not a separate allocation in the federal block grant, but a portion of the total treatment funds. To illustrate, the total block grant award from page 1 is included on the top of this slide. On page 2 below, the total funds for pregnant women and women with children plus the intervention treatment funds equals the total for block grant intervention treatment on page 1. This schedule of funding is also an amendment to the grant agreement. This means that DDAP received additional funds to award SEAs, and this schedule of funding is one part of a subsequently available funds amendment, or SAF. Amendments to the grant agreement are numbered sequentially during the grant agreement, so Appendix C7 means this is the 7th amendment to the grant agreement. It occurred in fiscal year 23-24 and was issued to the SCA on August 3, 2023. Anytime additional funds are awarded to an SCA, a new SAF amendment will be issued. This could be because additional funds are available, or the SCA requested additional funds for specific initiatives or to support the continuation of treatment services. Let's take a look at the bottom portion of this schedule. For this SAF amendment to the grant agreement, additional funds were awarded for the American Rescue Plan Prevention Grant and also for SOAR Year 6 Prevention and Treatment. In order to understand these awards, SAF amendment documents also contain a work statement. The SAF amendment work statement is a narrative that provides information on each funding source that is awarded in that specific SAF. This explains how much is awarded, how the funds may be used, when the funds take effect, and when the funds expire. The American Rescue Plan and SOAR funds awarded on this SAF are not considered base funds. They are subsequently available funds and are additional grant funds that became available to DDAP. There are some additional considerations for these funds, and this is where the work statement is extremely helpful. These funds have different awarding timeframes that are not based on the state fiscal year and may be carried over into the next fiscal year if not all of the funds are spent. The work statement will explain this, as well as when the funds expire and if there is a possibility the funds are eligible for an extension. Shown here is the first page of the work statement for this SAF amendment. Next, I will show you how this applies to SOAR Year 6. The heading of this page is an amendment to Appendix A in the grant agreement, meaning that additional funds were awarded, and this is SAF 7. This part of the work statement shows that the SEA was awarded SOAR prevention funds and shows how much the award is. This award may be spent starting September 30th, 2023, and the funds will expire September 29th, 2024. The SOAR grant is awarded based on the federal fiscal year, not the state fiscal year, like the base funds already covered in this presentation. Since the funds may be used past June 30th, the work statement explains that funds are not spent, may be spent for prevention services in the next fiscal year through September 29th, 2024. If the funds may be spent beyond September 29th, 2024, DDAP will notify the SCAs. The information contained in the work statement for SOAR Year 6 prevention corresponds to the amount awarded on page 1 of the Schedule of Funding. The second part of this work statement for SOAR Year 6 focuses on treatment and treatment-related funds. This information states the total amount of the award, when the funds may be used, and when they expire. Additionally, SOAR treatment funds are broken out into initiatives. All SCAs will receive funds for treatment services for uninsured, underinsured, and for case management and recovery support services. This SCA also receives funding for SOAR housing and housing-focused case management. The work statement for treatment funds includes the same information here as it was for prevention. Since the SCA was awarded American Rescue Plan prevention funds, the work statement includes the specific award amount in the work statement. What is different about American Rescue Plan is these funds do not expire until June 30th, 2025. Keep in mind, if the total for American Rescue Plan prevention on the schedule of funding is higher than the amount noted in the work statement, then your SCA did not deplete the funds from the previous fiscal year and they have carried over. Most of the time when you receive a new schedule of funding, it is a result of subsequently available funds, and you will receive a staff amendment. However, there are instances when you may receive a revised schedule of funding. Typically, this occurs more towards the beginning of a state fiscal year. When you do receive a revised schedule, the email you receive will include the information on why the schedule has been revised, and it is important to keep this information. Schedules of funding let you know what funds and how much you have available to spend in any given fiscal year, July 1st through June 30th. Now, as you're aware, DDAP now receives funding that does not coincide with the state fiscal year and can cover multiple fiscal years. When SCAs are awarded these grants, there are times when the funds are not depleted during the fiscal year. When these funds carry over to the next fiscal year, you will receive a revised schedule of funding in the next fiscal year to show how much of the funds you have remaining to spend in the current fiscal year. This SCA received a revised schedule of funding because they had not depleted their SOAR Year 5 funds and COVID funds in fiscal year 22-23. This schedule was issued to the SCA on October 24, 2023. This is not considered a SAF amendment since these funding sources were awarded in the previous fiscal year. The revised schedule shows the amount the SCA has to spend in fiscal year 23-24. This schedule is also the revised schedule for SAF 7. Since that is the most current SAF amendment. As previously shown in this presentation, the SCA received a SAF amendment on August 3, 2023, that awarded additional American Rescue Plan prevention funds and SOAR Year 6 funds. Back in August, the SCA had not finished invoicing DDAP for SOAR Year 5 and COVID funds at that time. Therefore, DDAP wasn't able to include that information on the schedule of funding then. As mentioned previously, this is a revised schedule of funding since it does not include additional funds that were awarded in fiscal year 23-24. For example, The SOAR Year 5 funds on this revised schedule were awarded in state fiscal year 22-23. These are the funds remaining that they may spend through September 29, 23 for services. For the specific award information, the SEA would need to review the work statement for SAP 6 in fiscal year 22-23, since SOAR Year 5 was awarded in that SAP amendment. The SOAR Year 5 funds were available until September 29, 2023, at which time they expired. Since SEAs may receive multiple schedules of funding either through carryover funds with a revised schedule or through a SAF amendment, it is always helpful and recommended to develop your own method for tracking these awards. When receiving a revised schedule that contains carryover, it is important to verify that your records match the amounts on the schedule. The most current schedule is the one you will use to plan your budget. If there are concerns, you can reach out to fiscal staff at DDAP and also your project officer. This is a lot of information to process, so it may be helpful to review this portion of the presentation along with your SEA's SAFs and revised schedules. If you still have questions or concerns after reviewing your own materials, you can always reach out to your project officer for assistance. Thank you for your time today. Next, Sue is going to review information for quarterly reporting.
Hello, everyone. My name is Sue Duff, and I'm the Division Chief for the Division of Program Monitoring. In this final section of the training, we're going to cover fiscal reporting in the SCA data site, or SDS. The objectives for this section of the training are for you to understand DDAP's requirements for quarterly fiscal reporting in SDS, including the timeframes and the steps involved each quarter. Also, to understand the importance of having all SCA contract information in SDS to ensure accurate fiscal reporting. And finally, to understand how to complete the quarterly reporting in the SCA data site, or SDS, through a demonstration. For those who are new, the SCA data site, or SDS, is a web-based system for the SCAs. In that system, SCAs are responsible to maintain contact information for the SCA, including address and phone number, and contact information for key SCA staff. Also, SCAs maintain all of their contracts with providers in this system. Those are done yearly and can be updated at any time. And then finally, as we're going to talk about today, the SDS is used for required fiscal reporting. There's a link to SDS on the slide, as well as this can also be accessed from our DDAP webpage. As an overview of the required fiscal reporting, each quarter the SCAs will enter all of their provider and the SCA expenditures into the SDS. These expenditures are entered by provider location, by DDAP activity code, and by funding stream. These reports are completed quarterly. However, each report reflects expenditures for the year to date. For example, Quarter 1 reports are for the period July 1st through September 30th. Quarter 2 reporting reports on expenditures for the first half of the year, which is July 1st through December 31st. Quarter 3 goes from July 1st through March 31st, and then Quarter 4 or year-end report is for, of course, the entire year, July 1st through June 30th. Each quarter, there are steps that are completed by both DDAP and the SCA to complete quarterly fiscal reporting. First, instructions will be sent to the SCA from DDAP when the SDS contract funding page is open for the SCA to enter their expenditures. Around this same time, your project officer will enter your DDAP revenue into the budget and revenue page of SDS. This revenue will represent any amounts invoiced to the department as of the end date of the quarterly report. The SCA is then responsible to enter their non-DDAP revenue in the budget and revenue page of SDS. The SCA will also enter their budgeted amounts by category on that budget and revenue page of SDS. And finally, the SCA is responsible to enter all of their expenditures into SDS for all providers, including the SCA, and will submit the report through the system. At that time, the project officer will review the report and will contact the SCA if there are any additional information or corrections needed. Once any outstanding issues are resolved, the project officer will approve the report and email the SCA to indicate their approval. In order for the SCA to enter their expenditures into SDS, they must first make sure that all contracts are entered into the system for all contracted services. The SCA is also entered as a contract in SDS to reflect services provided directly by the SCA. Expenditures and information must be entered for all providers. If the SCA did not make any payments to a specific provider, you'll report this in SDS by clicking No Expenditures for that provider. Here are a few reminders for entering your expenditures. Your pregnant women and women with children expenditures must be reported each quarter in order to ensure you're on track to spend these funds. Student Assistance Program or SAP expenditures must also be reported each quarter. Even though you no longer have a specific allocation for SAP, funds spent on this population must still be reported. Expenditures for level of care assessments conducted by contracted treatment providers must be reported in Activity 9100, Case Management, rather than in the treatment activity. And finally, support services, such as attorneys and IT, should be reported as SCA expenditures in SDS. The following slides will feature a demonstration of the steps that the SCA must complete in SDS for quarterly fiscal reporting, including entering non-DDAP revenue, entering budget amounts, entering provider expenditures, including pregnant women and women with children, and SAP expenditures, as well as how to indicate that providers have no expenditures, and then finally submitting the report within SDS. One of the steps in fiscal reporting is for the SCA to enter their non-DDAP revenue into the SDS. In order to do this, you're going to go into SDS. This is the home screen. You're going to click on SCA Budget and Revenue. You have to select the fiscal year. In this case, I'm going to select 23-24. And you have to select the quarter. And in this case, I'm going to select quarter 2. Now, I'm in the SCA, the SDS test site. And so there's just information in here, but it's not a real, it's not in the SCA live site. And so the way this budget and revenue screen is set up is that all of the DDAP funding sources are listed first from state general assistance, block grant, COVID, ARP, and then some of the other state allocations, CPGT, Act 2010-01, and then we go into the SOAR funds. So these are all the DDAP funding sources. As you'll see, the DDAP revenues have already been entered. Your project officer will enter your DDAP revenues for you for the reporting period. These are revenues for the year to date. And so since this is quarter 2, these are revenues from July through December of this given year. So that's the DDAP side. When you scroll over on this budget and revenue screen, this half of the screen is the non-DDAP funding sources. Not all of these are going to necessarily be applicable to all SCAs, but they are all listed here individually. And so you will, as the SCA, will enter your non-DDAP revenues into these columns. And the first line is beginning balance. That would be if you're carrying any funds forward from the prior fiscal year. Because the revenues that you enter on this second line here will be for the July through December period in this case, because it's quarter 2, so it's July through December. So I'm just going to go in and enter some just numbers in here to get some data in here for BHSI. We're going to say they have Act 152 money. Again, this is just dummy numbers that I'm putting in here. just to demonstrate how you put them in. You can use the tab to move back and forth between from one column to the next in the same line. We'll say that this SCA has the UI funds and nothing from PCCD. We'll say there's some interest income and there are some county funds, and that's all. So then when you scroll over to the end, see how this does not yet total these numbers that I put in. In order to get that to total, what you can do is you can scroll back over and hit refresh totals right here on your screen. You hit refresh totals and let it refresh. Then when we scroll back over to the other side, you will see that the non-DDAP allocations or the non-DDAP revenues that I just entered are now totaled here, and it's added to this total for the all funds is DDAP and non-DDAP revenue, and so everything is now totaled. Once you have that all done, you want to absolutely make sure that you go back here and hit Save Budget and Revenue, because that will save your work for you, and then you will get a notification up here in red that the data has been saved. The next thing that you'll do for quarterly reporting each quarter is that you will have to go in and enter your budgeted amounts. This is also done on this budget and revenue screen. We are still here because we just entered the revenues, the non-DDAP revenues. And so we're still here on this screen. However, if you need to get into this screen from the home screen, again, you're going to hit SCA budget and revenue. You're going to select your fiscal year and your quarter that you're working on. Again, we're in 23-24 quarter 2 for this demonstration. That again brings up your budget and revenue screen. As a review, you can see here that the DDAP revenues have all been added. And now in our last demo, we added the non-DDAP revenue. So everything is in here. From this screen, in order to enter your budgeted amounts, you're going to scroll down. And then down here, you're going to see a space where you can enter your budgeted amounts. Now, this is going to be your budget for the whole year for your SCA for these categories of activities. And so this is where you would enter those amounts. So again, I'm going to just enter some numbers in here just to get them in here. Intervention. And then for treatment. And then treatment related. Again, just entering some numbers in here. To get that to total, again, just like with before, you can go up here to refresh totals and then scroll back down and that will total it for you. Again, just information that I put in here. You'll also notice in this section of the budget and revenue screen that your pregnant women and women with children funds are listed here. This is also entered by your project officer to indicate what your set-aside requirement is for your pregnant women and women with children funds that Kelly talked about earlier in the presentation. Those funds are broken out by your general assistance, your block grant prevention, and your block grant treatment for a total there. And so that's what that is for. And then we're going to scroll back up here. Again, we're going to hit Save Budget and Revenue to make sure that that information has been saved, that the budget information that you entered, and we have the confirmation here that your data has been saved. The next step in completing your quarterly fiscal reporting is to enter the expenditures that your SCA has paid to each contracted provider for that funding period, as well as the SCA expenditures. In order to do this, there's two different ways that you can get to the contract funding screen to enter your expenditures. First, on the SDS menu, you can hit Contract Funding, and then you select your fiscal year. Again, in this case, we're doing 23-24. And then this brings up the contract funding screen. Now at the top here is going to be a list of every contracted provider for your SCA. And then down here at the bottom, it's going to show you the status of your quarterly reports. Again, for this example, we're doing quarter 2, so the quarter 1 report has already been submitted. So there's no option here for me to enter any quarter 1 data because, again, that's already been submitted. Once you submit your report to DDAP, you can't make any changes to it unless your project officer releases it back to you. And so we're working on quarter 2. And so in this case, we have incomplete quarter 2 data, this is the only place that allows me to enter anything. It won't let me enter anything for quarter 3. It won't let me select on these drop downs because it won't do that until quarter 2 report is submitted. So it kind of makes sure that you're entering your information in the correct quarter for you. So again, we're entering quarter 2 data. When I click on this drop down, it's going to show me the providers that I have not yet entered quarter 2 data for. And so there's only 5 listed because I did go in and enter some information ahead of time so that we could complete the entering of this information today during this demonstration. So I could select a provider from this screen right here. But before I do that, I want to show you the other way to get to this screen. So when I showed you, I'm going to go back up to the home screen. Before I showed you that you could hit contract funding to get there, you can also use these numbers here. Now this is going to show you what the status of your quarterly reporting is. So for quarter 1, again, that report had already been submitted. And so this says 0. There's 0 quarterly funding, quarter 1 funding report details that are due. And here, if you remember on the drop down that showed 5 providers, so this shows that there's 5 providers for quarter 2 that need funding details in order for that report to be complete. For quarter 3 and quarter 4, it's showing all 40 providers because, again, those have not yet been entered. So you can actually get to that same screen by hitting this number. And then that will also take you to the screen where you select your fiscal year, 23-24. And again, we're right back to where we were before. So we are going to go to incomplete quarter 2 data right here. We are going to select the first provider, which is Gateway Greenbrier. And then when you scroll down, it brings up their information here. You'll see that there was some data entered for quarter 1 in there. For quarter 2, I want to hit view and edit in order to enter their expenditures. So I'm going to click that. And then it's going to, if I scroll down, it brings up this screen. Now, this screen it's similar to the SCA budget and revenue screen in that the DDAP funding sources are going to show up first. So you have here in orange, you have all of the DDAP funding sources. And then in green, you have your non-DDAP funding sources. So those are listed over here to the right. And then, of course, it'll total everything for you at the end. So again, it's DDAP on the left and then non-DDAP on the right of your screen to enter your expenditures. And what we're going to do in this section here, we're going to enter for each of your providers. This provider, for instance, is contracted for both withdrawal management and for rehab. And in addition, withdrawal management, they also offer Vivitrol. So you're going to break out your expenditures based on whether the clients received no medications or whether they received any kind of medication-assisted treatment. The medication will be listed here. So that's how that's broken out, and then it will subtotal each activity. So there's a subtotal here for withdrawal management based on the 2 different options, and then down here there's a subtotal for rehab. Now the rehab, there's only 1 option of no medication. This is all based on what you have entered into SDS for your contracts. So for instance, if you go to enter your expenditures and you actually maybe this provider also uses buprenorphine and it's not listed here, that's because it's not listed on your contract in SDS. So you might need to go in and update that in order for that to show up here. So that's how these are all broken out. It's based on your contracts as they're entered in SDS. The expenses that we're going to enter, the first column here, you're going to enter your gross expenditures, and then the second column is going to be any amount that was actually not paid to the provider. So the most common example here is client liabilities. So if you have, a client that has a liability for services, those amounts would be entered here, and then your net expenses, which is the amount that you've actually paid to the provider, is going to calculate here for you. And so I'm going to start this process here. We're going to say that we're going to just kind of make up some numbers again. We're in the test site here. We're going to say that you spent $10,000, or we'll say $1,000 for clients who had no medication, and maybe you had one client who had a $50 liability. I know that's probably not accurate, but we're just going to put that in there as an example. And then for Vivitrol, maybe you spent $2,000 on clients there, and maybe they had 0 liabilities. And then what you can do in order to get the net total here that you paid the provider, you can hit refresh totals, and it will total that for you. Now, you will notice that this shows up in yellow and in red, and the reason for that is because there are errors that have to be corrected. The error here, it's not really an error, we just didn't get that far yet, is that this net expenses that you paid to the provider is not yet broken out by funding source. So that's what we're going to do next. We're going to break out this $950 and $2,000 across funding sources. And so we're going to start with the first line. You're basically going to say, oh, of the $950 that you paid to that provider for that funding period, how much of it was in each of these funding sources. So we're going to just enter some numbers just to get those in here. We're going to say some of that was state and some of that was block grant. Oops. And then we're going to say some of it was store. So we'll put that over here. I think I need 350 yet. So when I do that, now I put it all in DDAP funding sources. That just happens to be how that was again. I could keep breaking it out across to the non-DDAP. If I hit refresh totals again, if I did that math right in my head, that's no longer red because the $950 is total broken out across funding sources. So now we have to do that for the $2,000 here. We're going to say that that was for Vivitrol. We're going to say that that was some of that is from block grant. Say 1,000 of it is block grant. And then we're going to say 1,000 of it was from non-DDAP sources. So we're going to say maybe Act 152. We're going to say 1,000 of it was from Act 152. And again, we can scroll over and hit refresh totals again, and that should take our error away because now we had this $2,000 broken out among funding sources. So you see here also how this subtotal for my withdrawal management level of care here between the two, no medication and with Vivitrol, it totals it out, and so that those numbers all show up. So then the next thing I want to do here is at this point we're just going to say that there's no further expenditures for this provider just to move on to the next one. So we'll say that this provider is complete, that we didn't pay them for rehab at all. We just had a couple clients go for withdrawal management. Once you have your expenditures entered and you know you don't have any errors or anything, you can hit save funding. And then that provider, it's going to give you your totals here. And then that provider is no longer going to show up in this drop-down menu. So now there's only 4 providers left to enter expenditures. So we're going to click on the next one. Greenbrier Lighthouse for Men. We're going to enter expenditures for them, again, for Q2. In this case, this is a halfway house. And again, we have the options of no medication and Vivitrol. For this case, we're just going to say no medication. There were expenditures for clients for no medications in this funding period. We're going to say that we spent $5,000 on halfway house for this period, and there was liabilities or client income of $500. So that means that we have $4,500 is what we've actually paid to the provider. And so that's the amount that's going to be broken out. Again, I'm going to hit refresh totals to show that. Again, this $4,500 is not yet broken out in the funding sources, and that's why there's an error. And so we're going to break this out. One other thing I want to point out is that it doesn't allow me to enter expenditures under funding streams that don't allow for that activity. So this is halfway house, this is a treatment activity, and so it's not going to allow me to enter any of the prevention funding sources. It's not going to allow me to enter expenditures because obviously that's not an allowable cost for those funding streams. So for block grant, it's not going to allow me to enter it under prevention. It's only going to allow me to enter it under treatment. And we're going to We're going to put 2,000 there. And then we're going to put some in SOAR for this example. So our SOAR, this is again, it's the prevention SOAR column is not open. The treatment column is open. This was SOAR year. It's a different year, so we don't want to enter those. It wasn't during this period. It was during the second quarter, and so we're going to enter it here. We're going to enter another 2,000 here. And then we're going to go over to non-DDAP sources to enter something, and we're going to say that it was BHSI. And I honestly forget how much I still need to enter. I'm going to guess 500, but I don't know if that's right. But SDS is going to tell me if that's right, because when I hit refresh totals, actually I did get that right. So the 4,500, it's showing that there's no errors there. The expenditures that I paid to the provider for this level of care was $4,500. That is broken out among the funding sources here. If you scroll over to the right, you'll also see that 500 of that was from non-DDAP. 4,000 of it is from DDAP, and then the total is the 4,500. And so that is how we do that. We're going to again hit save funding to save that one. And then we are going to see that that is no longer in our drop down menu. The next one that we're going to enter, in this case, again, I'm in the test site. We're just going to say that this is Greene County. This is Greene County SCA that we are working with. And the other thing that you have to remember is that you have to report pregnant women and women with children funds as well as SAP funds. And where you do that is right here under when you have contract funding, when you bring up this screen, and you select the provider. We're going to say that the SCA had expenditures for both of these populations. And so we're going to click those, and then it's going to show up on our next screen so that you know how to enter those expenditures. And so I'm going to click both of those. We're on Greene County SCA, and I'm going to click View and Edit. And so this is going to be a little bit more extensive because we have all of the activities that the SCA provides, but then we also have a subtotal for pregnant women with children, or pregnant women, women with children, and student assistance program, excuse me, SAP, for each of the activities. We're going to make it a little bit simple and not enter expenditures for every one of those. But in this case, because the SCA provides all of the prevention activities and intervention and case management and some housing, it gives an option for the pregnant women funds under each of those. And so we're going to do a couple of activities here just to show you again how to enter this information. I'm going to scroll down to the treatment or the case management line to enter expenditures here. So this is 9100 case management, and you'll see that just like for every other activity, there's the line for the overall costs, and then there's the subtotal for the pregnant women and the subtotal for SAP, and then the it breaks it out that way. And so if we say that the SCA spent a total of $50,000 for case management for this period. Again, we're in the second quarter, so it'd be July through December, and say 1,000 of that was for pregnant women. We're going to enter that there. And maybe they had a couple of kids that were referred by SAP that were assessed, and so there was some SAP assessment as well. So we're going to put 500 there for SAP. And so when we do that, we're going to go up here again and hit refresh totals. And it's going to be red because we haven't broken these out by funding stream yet, but we'll fix that in a minute. But this just shows of that 50,000, 1,000 of this was spent on pregnant women, and 500 of it was spent on student assistance program. And so this is a little bit of a challenge because it doesn't freeze the panes up here. But we're going to break out these funding streams in order just to make this simple. I'm just going to say that it was state funds for all of it. So we're going to put 50,000 here. We're going to put 1,000 here, and we're going to put 500 here. Again, we would normally break this out among all funding streams, but I've showed you how to do that. So we're going to just make this a little bit easy on ourselves and say that we're going to save this funding. We've entered it, we're going to save it, and then we're going to make sure, whoops, I should have hit refresh totals to make sure that there were no errors, but it also will not let you save it if there are errors. And so, or it will leave it up here in the drop down if there are errors. So if it's not here anymore, then we know that it was okay. As I mentioned earlier, you are required to enter information for all providers, even if you had no expenditures for a provider. And so we're going to show you how to do that. We're going to select the next provider. Again, we're down to 2 more providers that we have to enter Q2 data for. So I'm going to hit pyramid, and same thing, we're going to hit Q2. I'm going to view and edit. Now, if I have no expenditures for this provider, I don't have to enter zeros. All I have to do is hit no expenses for this period. It asks me to confirm that I want to say that there's no expenses. The reason that it asks you to confirm it is because if you've entered data below and then you hit that no expenditures, it's going to delete all that data. So it just wants to make sure that you don't want to delete the data that you've entered. So I want to confirm that there are no expenditures. And then I still have to see how this checked here. And then I still have to click save funding. And so I'm going to save that one. And then I'm going to come back here to my drop down, and there should only be one provider left, Twin Lakes Center. We're going to click on that. And for this one, we are also going to say that there are no expenditures. So we're going to say no expenditures for this period. We're going to confirm that there are no expenditures. And then again, we're going to save that funding. Now, since that was the last provider that we had to enter expenditures for, we now have this now says submit Q2 report. And so since we've entered the data for all of our providers, we no longer have the option here to, it doesn't show that there's any incomplete. So it will make this button now active to submit that Q2 report. Now, if I realize that I have made a mistake and I forgot to enter some expenditures. Again, all of the providers are listed up here if you need to change any of them before you submit it. So in this case, I'm going to go back into the Greene County SCA because I realized that I forgot to enter some of my expenditures. And again, the pregnant woman and student assistant are already checked here because we've already entered those expenditures. So we're going to hit view and edit. We're going to say that we didn't enter our administration expenditures, so we're going to enter an amount in there for that. For this period, there wouldn't really be any liabilities for administration, so there's no revenue. And then we're just going to break out the admin expenses. We're just going to put them in state funding, and then we're going to hit save funding. And then it will update that provider's information. So again, even when they no longer are appearing down here as being incomplete, you still can access them and make changes to them by using this menu up here at the top, or this list up here at the top. At this point, we're going to say that our Q2 report is done. We've sent it, or we've finished it. We've entered all of our expenditures. And so therefore, I'm going to hit this submit Q2 report. I'm going to submit it to DDAP. It is going to ask you to verify that because again, it's going to lock all that data. You won't be able to make changes once you submit that report unless your project officer releases it back to you. And so I'm going to hit submit report, and then it's going to send it to DDAP. It's taking me back to this screen where it shows that I have no Q2 funding details left to enter because I've entered them all. If I would go back to that contract funding screen for 23-24, again, I don't have an option to do anything with Q2 because it has been submitted. This final section is going to show you how to fix an error if your quarterly report was returned by your project officer for corrections. So as you remember, we submitted the Q2 report. I went in and then made it as the project officer and indicated what changes are needed to that and sent it back to the SCA. So here we are back on the SCA home screen. We see here now again that this now says 1. that there's one Q2 funding report detail that we need to take care of because again, there was one that was sent back by the project officer. So again, we clicked on that one, we go into the fiscal year. Whoops, I hit something wrong, sorry about that. 23-24 fiscal year. Sure what it's doing. Let's try this. Go to contract funding. There we go. So this is, once you get into here, it's going to show you revisions to this year's fiscal data required for the following reasons. As the project officer, I said, please enter the prevention expenditures for the SCA, because if you remember when we entered the SCA expenditures, we didn't enter anything for prevention. And so the project officer flagged that. And so we have to now go in and make that change. So here you'll see that it says revisions required for, and it's going to show the SCA because that's the provider that was returned back to us. All the rest were approved. And so we're going to be able to go back into Greene County's expenditures. We're going to hit view and edit. And then we can go in and make the changes that we need to make. So we didn't enter any expenditures for any prevention activities. And so that was just the example that I gave for why the report was returned. Just for the sake of entering something and resubmitting it, we're going to enter some information dissemination expenditures. We're going to enter that there were $5,000 of expenditures. And for that, we used $2,000 out of the block grant prevention. Again, only the prevention column is allowable here to enter because it's a prevention activity. It's not a treatment activity. And so this column is not letting us enter anything. We're going to say that 1,000 of it was for COVID prevention. And then we're going to scroll over here. We're going to say that 1,000 of it was CPGT funding for prevention, and then 1,000 of it we'll put in non-DDAP. We will put it under Human Services block grant. I'm going to put it right there. So that should give us our total of $5,000. I will hit refresh totals to make sure that we are not showing any errors. It looks like it's correct. So we had $5,000 in expenditures for information dissemination. So I've corrected what the project officer sent it back for. And so now I want to resubmit, but first, of course, I have to hit save funding so that it saves the data that I just entered. And then since I did that, since I made a revision, it does say submit Q2 report. And so I'm going to submit that again to the to DDAP. And again, it's going to remind me that when I submit that, again, I won't be able to change anything unless the project officer sends it back to me. And so I will hit submit report, and then that will send that on its way. Again, this changed again to a 0 because I addressed the revision that was required. So those are all the steps in quarterly reporting. Here are some additional resources regarding quarterly fiscal reporting in case you have questions moving forward. As mentioned previously, reporting instructions are sent each quarter. While the process remains the same, funding streams sometimes change and the instructions will have information applicable to that year's funding streams. The instructions are also more detailed than what we could cover here in this presentation. In addition, as with other sections of the training, you can consult the fiscal manual on our website for specific information about funding streams and allowable activities. And finally, you can reach out to your project officer with any questions as you complete your reports each quarter. One final thing to note, at the beginning of each fiscal year, DDAP sends out a report schedule to every SCA. This schedule alerts SCAs when reports and information is due to DDAP and where to send it. We recommend keeping a copy of this close at hand. If due dates are revised, you will be notified by DDAP via email. If there are difficulties meeting a deadline, please reach out to the appropriate DDAP staff or resource account on the report at least 1 week before the deadline. This concludes the SCA fiscal training. We hope you have found it to be a helpful resource whether you are new in your role or are reviewing this training as a refresher. We'd like to thank you for all the work you do every day to ensure your SCA runs smoothly. Please contact your SCA's project officer with any questions on any of the material presented here. Their contact information is displayed on the screen. Thank you and have a great day.